Microcytic anemia, also known as iron deficiency anemia, is the most common nutritional deficiency. Iron deficiency anemia is caused by blood loss, malabsorption, a decrease in iron storage, or an increase in physiological need. The most common cause of blood loss is gastrointestinal bleeding, which occurs due to malignancy. Malignancies such as gastric and colorectal cancer can cause severe blood loss. Now, the second cause is some parasitical diseases such as hookworm and schistosomiasis. Now, the third cause is inflammatory bowel disease. Also have peptic ulcer, and finally Meckel's diverticulum. Blood loss may be caused by the chronic use of some drugs such as aspirin and non-steroidal anti-inflammatory drug. Malabsorption of iron is caused by celiac disease. It might be also caused by achlorohydria, which is the absence of hydrochloric acid in gastric secretion, and it is caused by gastric surgery or the chronic use of proton pump inhibitor drugs, PPI drugs. Pregnancy, lactation, and menstrual cycle decrease iron storage. Clinical pictures of patients suffering from iron deficiency anemia. They're gonna look pale, lethargic, weakened, and easily fatigued. Patients will also suffer from glossitis and stomatitis, which are inflammations of mouth and tongue. They will also suffer from dysphagia. And finally, they will have tachycardia and cholonychia. Cholonychia is the spawning in fingernails. When doing investigations to patients with iron deficiency anemia, we're gonna notice that they have a decrease in 5 levels. First, in the level of hemoglobin, then in the level of MCH and MCV, and the level of transferrin, iron storage, and serum ferritin. Serum ferritin is considered the best diagnostic test for iron deficiency anemia. On the other hand, they're gonna have an increase in only one level, which is total iron binding capacity. Patients with iron deficiency anemia are managed by giving them oral ferrous sulfate. Ferrous sulfate is the drug of choice, but it has many side effects such as nausea, melena, and finally abdominal pain. Parenteral preparations are given to patients who are unable to tolerate oral therapy, so it is given IM or IV. Finally, patients with iron deficiency anemia can be given blood transfusion.